It's stress reducer for the staff as well as the patient because they're excited about it. Patients like it. Even today it was a stress reducer for someone who needed a new 3-unit bridge, 2 posts, and weren't happy. Unfortunately, it's a true story, they were watching CNN and there was some news on CNN. It wasn't really good news for some people. And the patient looked at me and said, well, it could be worse. I could be in that country right now instead of here, worried about a bridge. I mean, it was bizarre, but in reality, the dental chair potato put her concerns about her bridge into priority in life. I mean, it was bizarre, but it happened today. It wouldn't happen with the TV necessarily because, number one, they aren't as much in control. The glaring light would bother them. And most of them are off in the corner. So they're reaching, looking, or they're trying to look through the assistant. So it isn't accessible. I mean, here, they're looking at it while I'm working. There's no concern about being in my way. No concern about their position. I mean, they're just there. It's there. It's in their face. The other experience I had twice in one day was I was taking an image, an intraoral camera image, on a patient for an insurance company to show a fractured tooth. So I took the camera, and number one, I noticed when I'm taking images, I'm not looking at the monitor behind me or around me. I'm looking at the one right there. But who else is looking? The patient was looking. So the patient's looking at the monitor, and he grabs the camera out of my hand, starts doing a tour of his own mouth. One of the other lecturers in technology, Claudio Lovato, always says new patients need a tour of the mouth. Well, if you give them a tour of the mouth, you have to go do the tour, sit them up. You're in an uncomfortable position, the patient is, or you have to snap them and grab them and then sit them up. Here, they're actually participating in it. The other thing that happened today was a patient commented, she remembered her dentist from the 1950s, so it's 50 years ago. She remembered her dentist there, and what impressed her about him, what she remembers today, of all the dentists she's had in her life, was that he had a color TV in his treatment room. And now she said, you're just like him. But it's 50 years later. But of course mine would be the state-of-the-art version of the same thing. There was another thing that came up by a patient. I'm 60 now. And people, especially new patients, wonder, how long will I practice? Is he retiring tomorrow? I get used to a new dentist. People have a difficult time changing. Well, they see the dental chair potato. That's gone. Oh, you're modern. Oh, you keep up. The next time you're at the dental show, and I have a great slide that was given to me by Dr. Unthank, who designs offices, and he showed a picture of a colleague of his laying in a dental chair at a convention show, and the monitor was nowhere visible, although it was mounted on the chair, to the patient laying in the chair. It was a great slide he took. So why don't you go, you can go to the dental show and go and look at these monitors mounted on the chairs, mounted on the poles, mounted on the ceiling, lay in the chair, put on the light, get in the patient position, have the light on, and then see what happens and see where you think it should be.